Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper arch, upper right, and upper left for implant placement. This is the panoramic view. Distal to the upper right 5, we can show you the bone situation. On the transaxial view, this is basically the proximal view. We've got a very thin knife edge ridge, approximately 3 to 4 millimeters below the ridge. The ridge width is 6 millimeters and the height here is 7.6 millimeters. So a shorter and wider implant can be placed in the upper right first molar region. When we move towards the upper right second molar region, we've got again a very thin ridge. We've got approximately 4 millimeters of ridge width with approximately 6.8 millimeters of ridge height. Sinus lifting procedure in the upper right maxillary bone is definitely advisable and can provide us with good implant support. However, something to be noted is that because of the atrophy of the ridge, the center of the ridge has moved quite palatally, and just below the center of the ridge, the nasal septum or the nasal side or the medial side of the maxillary sinus is going to be visible. So either if the sinus lifting procedure is done in the region of the 6, it's not going to be very beneficial. In the region of the 7, it will be beneficial, as the medial wall of the maxillary sinus is going to be much more medial. So we would advise sinus lift in the region of the 7, but would not advise a sinus lift in the region of the 6. The other very important aspect in this is that this is the upper left lateral incisor, the maxillary lateral incisor on the left quadrant. Here again, we don't have architecture of the mesial, the buccal or the parietal cortical bone. We've got severe ridge atrophy. The ridge width in this region approximately is 6.4, but this is going to be very apical bone in the apical 1/3 of the adjacent central incisor, and we've got approximately 8 millimeters of ridge height. On the upper left hand quadrant, this is distal to the upper left 5, we've got healthy bone. We've got a slightly thicker ridge. We've got 5.8 millimeters of ridge width with a good 11 millimeters of ridge height. The bone quality in this region is D2 with a good healthy cancellous bone. In the region of the second molar, again, we've got very healthy bone. We've got a slight root piece that is left from the previous tooth, but here the ridge width is absolutely fantastic. We've got 9 millimeters of width with a good 9.5 millimeters of height. So the upper left is definitely something that we can place implants without any problems. We've got good healthy bone, we've got good healthy ridge, and we can place implants without any major sinus lifting or major grafting procedures. So if there are any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. Thank you very much.